I think we're evolving a molecular pattern that allows us to think that, for example, in BRCA1, PARP inhibitors may have a role. I think this is a cauldron. I think what's been really cool this year, it's awful with COVID being around to screw everything up, but what I think has been good this year is as you run through ASCO GU, AACR, and the recent ASCO online meeting, there's actually a lot of stuff happening in the prostate space. I think there's absolutely nothing to be gained at the present time by trying to figure out the respective merits of enzalutamide, darolutamide, apalutamide, abiraterone, and so on. I will make the comment editorially without a whole lot to back it up. So this is more kind of like NCCN. I got together in a room by myself and made a decision, and then I called Earl Burgess and Claude Grigg, my two GU guys, and said, this is what I think, what do you think? And we all agreed, and so we're not as powerful as the NCCN, so we didn't write a guideline, but I will simply say what we've done, we've stopped using abiraterone and prednisone in favor of enzalutamide through the COVID epidemic. Now, you being experienced oncologists will immediately say, it's only 5 milligrams of prednisone. My response will be, particularly in elderly people, the level of immune suppression that comes even with 5 milligrams of prednisone is variable. If I didn't have alternatives, then I'd certainly use it because, as we'll talk about in a minute, adding ABI has been really important. But at the moment, there are alternatives. So we're tending not to use prednisone-associated treatments if alternatives are available. The other thing that I think has been really interesting is at the ASCO annual scientific meeting, there was a very interesting presentation, needs validation, and I'll make the comment, and Dean Gesby knows how I feel about this. I like practice change to happen after the randomized trial has been published, not when it's presented at ASCO. So I'm not going to dignify this work by naming the drug. I will simply say there is a new drug around which looks promising, and in a randomized trial, it's an oral version of an LHRH antagonist.